and start the festivities.
Thank you, Amanda. As she mentioned, my name is Chip Decker. I'm the president of AIMHI and the CEO of the Richmond Ambulance Authority in Richmond, Virginia. I'd like to welcome everybody to the Academy of International Mobile Healthcare Integration's 2020 Excellence in EMS Integration Awards celebration. While we regret that we're not able to see each other in person, we would normally be doing this at one of the national conferences. We're thrilled to have the opportunity to recognize the exceptional people and programs we're honoring here today. In spite of everything that is going on, we thought it's still important to recognize the good work, the ongoing work of folks like you all that are doing, across the country and across North America. So I'm joined by my distinguished AIMHI colleagues who are EMS leaders and influencers from across North America. I'd like to give a shout out to our President-elect, Kevin Smith from Niagara, Canada. I saw Kevin's on. Welcome, Kevin. And I would be remiss if I did not recognize Amanda for all of her assistance in helping make this virtual event a reality. So thank you very much, Amanda. Is it like this or is it like that? Or okay. So a little bit about AIMHI, for those of you who may not be familiar. The Academy of International Mobile Healthcare Integration, and hopefully from now on I'm going to just call it AIMHI, represents the high performance emergency medical and mobile health care providers in the US and Canada. Member organizations are high performance systems that employ business practices from both the public and private sectors. And by combining industry innovation with government oversight, AIMHI affiliates are able to offer unsurpassed service excellence and cost efficiency to their communities. And here, the current AIMHI members, I'd like to thank them for their ongoing support and participation as we all work collaboratively to promote high performance, high value EMS, share ideas. And this is basically where I learned how to be a good CEO. It's from all the expertise that is in the room, or in this case, virtually. So if you'd like to learn a little more about high performance EMS, high value EMS, please just visit our website, aimhi.mobi, and download a copy of our member benchmarking report. This is something we do on a regular basis to compare ourselves to each other. And we try and hit all the latest industry trends, issues, and come up with a benchmark and a way to assist in making us all a bit better at what we do. So with that, it's my honor to invite the nominators and the winners of today's awards to speak about the programs that we are recognizing today. So I think we're gonna flip to Linda, right? So, Linda Fredrickson, one of our longstanding AIMHI members. It's my honor and pleasure to recognize AIMHI's first Lifetime Achievement Award winner. Linda, in addition to many years of service on the AIMHI Board of Directors, Linda has led Medic EMS in Davenport, Iowa since 2004. She's held the offices of President, Vice President, Treasurer of the Iowa EMS Association, as well as numerous other official roles in regional and national mobile healthcare organizations. A critical care paramedic, a registered nurse, an emergency medical dispatcher, oh my. She holds a master's in public administration from Drake University. Now it's my pleasure to turn to Chuck Gibson of Medic EMS, who nominated Linda for this honor. Chuck, will you and the Medic team please share some insights into her impact in Davenport and beyond?
Thanks, Chip. We appreciate it. Quite an honor to have Linda nominated by us here at Medic EMS, as well as being awarded the award for Lifetime Achievement. A lot of the things that you had mentioned there is, just a snapshot of the many things that she's done locally, within our community, within our state, and nationally. I was looking back, very humble, was not real happy with me that I actually nominated her for this, and said that there were several people that were much more deserving, but I disagree, which is why I nominated her. And like I say, she wasn't real happy because of a very humble person. And now that we have witnesses online here, if I disappear and you find me in a river somewhere, you'll know what happened. But some of the other things you had mentioned, being a long-term member, I was kind of going back and Mark, of course, Postma before Linda here at Medic. We were part of when it was CAIMS, and even before that, if some of you know back far enough, when it was napalm. So kind of exciting to be part of this and leading and moving forward all from the beginning. Some of the things that we had thought about and written down when we talked about nominating her for this, and some of the things that come to mind, and those of you that know her will certainly know this better than I. Some of the words that come to mind is being humble, having integrity, being tireless, always on the forefront of doing what needs done to make sure that things get accomplished for the betterment not only of Medic, but our community, our state, and our nation as well. Very altruistic, likes to give and do the work and really expects nothing in return. In fact, with this award was quite humble and wasn't expecting that at all. So we're very appreciative of the altruistic humbleness that she has. And the big one that really comes to mind is servant leadership. When you think of a leader, one of the things that we want is one that's out to do it for somebody else, not for themselves, not looking for what they can gain or what they can put their name on, but the legacy they leave kind of behind the scenes. So that was really the driving force as to why we nominated for Linda for this award, and very excited that she has been awarded that. It was nice that Mark Postman was here about a month ago, and we did a little bit of a handoff and got some pictures with them as well. So he was able to give that as well as the video that was posted on the website here. So thank you very much, and congratulations, Linda, on winning your award.
I was going to slide Chuck up there and choke him real quick. But I want to thank our team here and thank everybody at AIMHI. We certainly get much more than we ever give to AIMHI, and it's just impressive to see all of the the fabulous leaders and mentors and really icons in the EMS industry. We couldn't be more pleased or grateful for our membership in AIMHI. Sure miss getting to see everybody. We're all sitting here in our masks trying to set the example, because we in Iowa, big hugging state, we have a huge positivity rate right now. So we're trying to make sure that our staff and everybody stays healthy. Looking forward at all the challenges in healthcare. Again, we're very grateful for organizations like AIMHI that get together, do great things like benchmarking surveys, collaborate, and do some wonderful things together. So many others that are sitting on this call right now that are much more deserving than I think this might be the old lady getting ready to retire award, or it could be the old man getting ready to retire award. But thank you from the bottom of my heart. I'm very humbly accept that, and I'm very grateful.
Well, congratulations, Linda. I think it's very deserving, very deserving. You've always been very helpful to me and a great leader up in Iowa.
Thank you.
So, moving along. I think we're doing the excellence in EMS integration. So, I'd like to recognize Vitas Healthcare's innovative program integrating EMS and hospice care. While Vitas is not able to join us in person today, we'd like to invite nominator Matt Zavodsky to share a little bit about this program that is improving the end-of-life care for patients. Matt? I think he's changing the tire.
I asked him to unmute. He seems to be caught up. Matt?
He's muted.
Okay.
Wait, no, Chip made it so that I couldn't unmute. What's up with that?
It finally worked.
And I'm going to continue wearing my mask following Linda and Chuck's lead, but also, need to do that. But also because we're going to have a little bit of surprise in a few minutes. But VITAS Healthcare, this partnership was designed to reduce preventable hospice revocations and enhance the experience of patients and families enrolled in this program. It provides a safety net in the event that a hospice-related 911 activation is activated. The patients and families who are at risk for the potential 911 activation are identified by VITAS and their team and are referred to MedStar for enrollment in this program. Just from an outcome perspective, because we're really trying to focus on outcomes, so far, 462 patients have been enrolled in this program, and 911 was activated for that population 208 times. As you know, most of the time when hospice patients call 911 or their families call 911, they almost always result in a transport. But in this particular case, only 108 patients were transported from the home to an emergency department, or from the home. 17 of those were transported to an inpatient hospice unit. Of the 462 patients that were enrolled at the time of the award nomination, only 89 experienced a revocation. And remember that these were patients enrolled in this program that VITAS were sure were going to revoke their status. So to have that low of a revocation rate, 19%, is a huge success for the patient, the families, and certainly for VITAS. This program has been profiled in numerous healthcare journals and was also profiled as a best practice by the Advisory Board Company, which you may know is a premier healthcare policy organization that also studies data on outcomes from healthcare system utilization and value-based purchasing. So Steve is the GM of VITAS here in Fort Worth, has been a great leader in doing this project, and we were very happy that he was awarded this award, and we were honored to nominate him.
Thank you, Matt.
Thank you, Chip.
All right. Next, we have the 2020 Excellence and Value Demonstration or Research Award winner, Northwell Health Center for EMS. And they're being recognized for their groundbreaking study that demonstrates that video elements are not essential to effective telehealth. John Washko and Dr. Brashkin, are either of you here to share with us a bit about your study?
I see Dr. Brashkin is here, and she is our first two-time winner.
Oh, wow.
Here,
Yeah.
I was really deferring to John. I'm not sure if he's on the call as well. Are you here, John?
I've seen John.
He accepted,
right. Well,
but I haven't seen him pop on.
Happy to represent our group. I'm happy to give a little overview, or how do you want me to approach this?
Overview would be just fine.
Okay. Well, I really appreciate, being a two-time award winner. It's really amazing. I've learned more about AIMHI kind of coming from the primary care space. It wasn't a group that I was originally, a couple of years ago familiar with. And just learning about all the great work that everybody in this organization is doing, it really makes winning this award really something special. So I really thank you all for recognizing the work that we've done through Northwell. And this study in particular was really based on our community paramedicine program, which is operating within our house calls or our advanced illness management program. And we wanted to see if there was a difference in outcomes when our patients had community paramedicine responses with video or without. We had integrated video in our CP program really as what should have been a standing part of the program a number of years ago. But what we found was that due to service failures, due to technology limitations,
we were only really effectively getting video in about 50% of our CP responses. And that set up this natural experiment that allowed us to compare outcomes with and without video. And certainly we've done quality improvement work in trying to enhance our video utilization rates, but it just hasn't always been possible. You guys all understand patients living in the basement, people without any cell phone towers or any kind of reception near where they live. And so we had this natural experiment set up. And our hypothesis was that there wouldn't actually be any difference in outcomes because the paramedics participating in the program do such a great job by nature of their training and their experience in painting this picture of what's going on visually and really conveying the information in a way that didn't always require a video to the physician on the other end of the line. And that is what we ended up finding when we analyzed the data. So we found that video enhanced the response subjectively when the physicians answered the question as to whether video provided an enhancement. When it was available, they really appreciated it and liked having it. When we actually looked at the outcomes in terms of transport rates, we didn't see a difference. And so, I think this really lends to the fact that video should be tried. Video is an important piece of patient evaluation, but it's not the be all end all, and that we really wouldn't want program growth, this type of physician extender model, treating patients in the home, to be limited if a program's in an area or a part of a program's in an area where video is not available. So we're hoping that this work can influence policy, can influence program development, so that folks are not limited in the care that they're providing to patients just based on whether a video is or is not available. So that's all I have to say. Thank you all again. It really is a great honor, really great honor to be a part of this group as well as a primary care doc. I may not be the first one you'd invite to the table, but I really appreciate it. And it's really a special group of people. And I just thank you very much.
Well, thank you also. And yeah, amazing study. Amazing study. Yeah, because we just don't have coverage in a lot of places, and we've been doing it for years, and being able to paint a successful picture to the ER doc when we were coming in just over the phone and using audio. So thank you for taking the time to chat with us today.
My pleasure. Thank you so much again.
So next, the 2020 Excellence in EMS Integration Award winner, Montgomery County Adult Protective Services. So let's honor Montgomery County Adult Protective Services in Maryland. Montgomery County Fire Rescue Service is the top referrer of cases to their county's Adult Protective Services. And Avatar, or if you would tell us a little bit about the partnership that led you to nominate APS for the AIMHI Excellence in EMS Integration Award, please, sir.
Absolutely. Thank you guys so much for choosing our prestigious partner, Montgomery County Health and Human Services Adult Protective Services, as one of the award winners this year. We were so, I guess, surprised to see that this collaboration took off as well as it did. I don't think any of us really were surprised that, adult protective services and fire rescue kind of go hand in hand. But I think that when you try and blend two different departments, you can often have, some speed bumps along the road. And I can gladly say that was not the case with APS. They've been our partners from very early on in our MIH program in Montgomery County. And they've done nothing but support our efforts and help us work with not only our providers in the field, but also community partners to make sure that we're spreading the word appropriately about when to engage APS. So we've done some educational opportunities where we've put up flyers in every single firehouse to kind of inform our providers about when it's appropriate to report APS. I'm sorry, my son is very excited about this as well. And we also feel like, you know, we've done a great job of educating our clinicians and reminding them that as mandated reporters, it's really important for us all to kind of work together.
A
lot of excitement in that house.
She's got some serious competition.
I run a zoo. I'm sorry.
That's all right.
So we have, like Chip alluded to, we've become the #1 referrer source for adult protective services in terms of actual investigated cases. There's about a 20% investigation rate in Montgomery County, which is very standard across the state of Maryland, where about 20% of all cases that are referred to APS are actually investigated and manifest in a investigator going out and taking a look at things and opening a case. And for fire rescue, 100% of our referred patients end up being investigated, and that's huge. To me, that says that we're moving in the right direction. We're really working very hard to educate our clinicians and to identify patients quickly so that they can get the help they need. And we're really proud of that relationship.
Excellent. Thank you very much, and congratulations. And thank you for nominating Montgomery County APS. So, and I hope everybody stays happy. So, I don't believe we have anybody from APS on the line.
We do.
Oh, we do. My bad.
That's okay. I'm Denise Gambrell, and I am from APS. And I've been with APS for many years, but never thought that I would enjoy the experience of having the opportunity to work with EMS. I've learned so much about EMS by doing this. I'm learning more as I clinically supervise the nurse and social worker that were hired for this team. And it's been a real privilege. It's been exciting, and we consider fire and rescue to be our preferred partner.
Excellent. Thank you, and congratulations to your group.
Thank you.
I know we use APS and refer many here in Richmond, and but I wish ours was the relationship was as robust as what you all enjoy, and so it's kind of one of the things that gives me an opportunity to work towards. So thank you very much for your participation and bringing this forward and letting us know what can be. So thank you. Congratulations.
Thank you.
So next, the 2020 Excellence in Public Information or Education. And congratulations to the Richmond City Health District from my hometown on its win for the First Responders for Recovery program. This nomination was submitted by my team at the Richmond Ambulance Authority. Mark Pena from my shop, would you please share with the group how this program has helped us to collaboratively serve some of our city's most vulnerable patients?
Absolutely, it's my pleasure, and we were thrilled to nominate the Richmond City Health District and are thrilled that they received this honor. This is an idea that was conceived in the fall of 2018. We've worked with the Richmond City Health District for years on the Regional Opioid Task Force in our efforts to try and combat the opioid epidemic in our area. In 2018, our agency tried to find ways that we could potentially help our patients that suffered from addiction even more. And so we started looking at programs across the country, and we looked at really two things. Was it a program that we could simulate here in Richmond, and was it evidence-based and had a proven track record of success? We were able to find a program that we liked that was in St. Charles County, Missouri, which is near St. Louis. And essentially what they did was have patients sign a release form, allowing their contact information to be shared with addiction recovery organizations in that area. Our CEO, Chip, approved us trying to create something similar here and made it a point that we work with the Richmond City Health District just because they've been leaders when it comes to combating opioid addiction in the Richmond area. And so we had a discussion with the Richmond City Health District and asked if we could create something where we could have patients sign a release form and then have someone from the health district follow up with that patient and try and get them connected to recovery resources. And they were actually in the process at the time of hiring a peer recovery specialist, and they hired someone named Courtney. Now, Courtney struggled with addiction for many years until she was put on the path to recovery by first responders. So she was the perfect fit for what we had in mind. So at that time, we worked to get everything in place. And through our program, Courtney trains employees at Richmond Ambulance Authority on different methods and techniques they can use on someone who is overdosed or they suspect has an addiction to try and get them to sign a release form. Once those patients sign a release form, a peer recovery specialist from the Richmond City Health District contacts them within 48 hours and tries to get that patient connected to recovery resources. If they're able to make that connection, that information is communicated back to our agency and then communicated to the crew that got the signature. And that has been a key to the success of this program, because in so many cases in EMS, our folks are taking people to the hospital, but there is no resolution. They're not sure what happens after that. So having that communication and letting them know that they were successful in actually getting this person connected to recovery has been essential in the success of this program. I remember when we first started this, we were hoping to get maybe a couple dozen signatures within the first year. In the past year and a half, we've actually gotten over 200 signatures. And the agency is working on improving the program even more in the upcoming year, just to continue the success we've seen. And RCHD, the Richmond City Health District, has been instrumental in the program's success and helping put patients on the path to recovery. So we're just thrilled that they were recognized for their work, and we're thrilled to have them as partners in this program.
Thank you, Mark. Do we have anybody from the Health District on? I can't see everybody.
I thought I saw them, but it looks like they might have dropped off. But if they hop back on, it could be a famous Zoom technical difficulty. We can let them talk at the end, if that's okay. But Mark did such a great job with an overview. I don't know what they'd say.
He's good at that, thankfully. So, all right. Next, the 2020 Leadership in Integrated Healthcare Distinguished Service Award winner, R. Paul Miller. EMS Division Chief Paul Miller of the Crawfordsville Fire Department is being recognized today with a Distinguished Service Award for his exceptional impact on his community through Project Swaddle. Chief Miller was nominated by the Indiana State Department of Health. And Gretchen Miller is with us today. Would you please share with us a bit about the program?
I'll share a little bit, and I'm going to let Paul do most of the talking, because I think, as you'll see, you'd much rather hear from him than me. I am a social worker and not part really of the EMS world, so I'll let him discuss the program. But Paul, we were happy to nominate Paul because he is literally the best partner you could ask for at the state level and in his community. He works tirelessly to do whatever he can to make his community better and reach anyone that needs help and support. So we are just thrilled to nominate him and have appreciated all of his help and support with various projects that we've worked on. But I will let him discuss Project Swaddle, which is an amazing program that helps provide a lot of pre and postnatal care that's greatly needed in his community.
Thank you, Gretchen. So Project Swaddle is one of our unique partnerships that I think is one of the most advanced and integrated systems of care in the country, bringing more support to high-risk pregnancies, both clinically and socially high risk, to provide better outcomes. And it came out of need through Indiana Department of Health. We are worst in the Midwest in both maternal and infant mortality. And what we're able to do is bring a non-traditional support system in the home through EMS. So our firefighter paramedic is one of the only firefighters I know of in the entire country that is trained in Lamaze education. He's milk mob certified, so lactation education, postpartum depression, motivational interviewing, and he is able to bring a unique clinical support to provide better outcomes. Right now, we've had over 130 high-risk pregnancies enrolled in our program, risked with preterm delivery. And by bringing care into the home, point-of-care testing, McKenna injections, we've been able to deliver all but one full-term with appropriate birth weights. So it's a program that has been getting a lot of recognition around the state and support from commercial insurers. So we're looking at replicating this in up to 5 different communities in Indiana this year. And it has brought in additional support in our Cradle to Grave project that is allowing us to start doing immunizations in the schools and in the community. So it's a full cradle to grave support. And we have just onboarded our 5th full-time community paramedic to our department. We have 3 additional community paramedics on each one of our 24-hour shifts. And we have an early intervention specialist all through the Indiana Department of Health and their kind of partnership. So we're very excited about everything we're doing to move forward with this project.
Well, thank you, Chief.
Thank you.
That sounds like you're doing some good work way out that way. So congratulations on your award. So next, 2020 Leadership in Integrated Healthcare Research Award winner. Congratulations to Dr. Brad Cannell, whose research and dedication we are recognizing today. Matt Zabadsky, you're up again. If you would fill us in on how Dr. Cannell is making an impact on elder abuse.
Thank you, President Decker, and thank you for the opportunity to introduce Dr. Brad Cannell. Brad led an effort with 2 universities to test methods to make it easier and more reliable for EMTs to identify potential victims of elder abuse and neglect. Brad has been the principal investigator for 2 studies for the detection of elder abuse through emergency care technicians, otherwise known as the DETECT studies. MedStar was blessed to participate in both of these studies and has implemented training and electronic patient care report worksheets to support these studies. In the most recent study, MedStar community paramedics conduct face-to-face interviews with patients screened as being at high risk for potential elder abuse to test the worksheets for accuracy and reporting. During the initial study period, MedStar medics reported more than 4 times as many cases of elder mistreatment during the implementation of DETECT, and 82% of the cases were validated by APS. So Maryland folks, the APS partnership, this is another opportunity for doing some work with your EMS system. The findings suggest that incorporating a program like the DETECT screening tool could really help enhance the identification and appropriate reporting of elder abuse and neglect. And we have a very special treat. Brad is actually here with us. So we're going to officially hand the award to Brad and let him talk to you guys a little bit about
it. Doesn't show up.
Oh, because it's clear?
Yeah.
Oh, God.
It's here, I promise.
So Brad.
So thank you so much, Matt, and thank you so much, everybody at AIMHI for this award. It's really an honor and was unexpected. All I can say, I think in addition to what Matt said, is that, MedStar has been a partner since the very beginning of this thing back in 2014, and I really couldn't have hoped for a better partner. Their willingness to innovate, their willingness to think of new and novel ways to serve the older adults in our community is really a blessing to our community. And I'm really, really happy that I have the partnership with them and hope it continues for many years. I guess one more thing I could add is that I am involved in other projects to identify elder abuse and neglect, for example, in the emergency department or in primary care settings. And I think those are valuable projects, but I can't emphasize enough how many of older adults in our communities are socially isolated and are not even making it into those other environments where there's potential for these circumstances to be noticed or detected. So, you know, not that we shouldn't be doing those other things, we should, but EMS in general is an invaluable partner in our effort to sort of understand the burden of elder abuse and neglect in our community, because oftentimes EMTs and paramedics are the only people that some of our patients will encounter in a given year that even have the opportunity to recognize that this is going on and connect them with services they need. So, so I can't say enough for MedStar. I can't say enough for the importance of EMS playing a role in the detection of elder abuse and neglect in the community because of this, particularly because of the social isolation aspect. And again, I want to say thank you to AIMHI and to MedStar and Matt Zavadsky personally for nominating me for this award. So thank you.
And thank you, sir. Congratulations on your award and the good work that you're doing out there with MedStar. So, moving on. Next, well, we all know 2020 has been an extraordinarily taxing year for EMS, particularly COVID-19 hotspot areas, like in New York City. Empress EMS's Hannon Cohen was nominated by Patient Care EMS, Cindy Stone there, for his exceptional service during his city's time of need. I can't even imagine. Is there someone from the patient care team that can share a little bit about Mr. Cohen's impact?
So, Chip, I haven't seen Cindy Stone on, but I do know that Jim O'Connor from Empress has joined us. And on one of my other hats is I'm the Vice President of Membership for the American Ambulance Association, and we wholeheartedly recommend or echo this nomination, because we've, even just this morning, I was bothering Hannon with COVID-19 questions. So with that, I turn it over to Jim, who I believe will be speaking for Patient Care and Empress today.
Yeah, thank you, Amanda, and thank you to the association. I am proud and honored to represent Empress EMS and Patient Care EMS in the nomination and the selection of Hannon Cohen for this prestigious award. Hannon is our Director of Mobile Integrated Health, as well as our business development area. Hannon has been involved in EMS for 30 years. I consider him a friend and one of the few people that I can speak to about the virtues of the Life Pack 4 that knows what I'm talking about when I talk about the Life Pack 4. But 6 years ago, exactly, 6 years ago, Hannon went on the venture to understand more about mobile integrated health. He and I have talked about the idea of the feeling that, just as the way I describe it is, when ambulance services or EMS went from BLS to ALS, that was a watershed moment. And I believe mobile integrated health to be a watershed moment as well. So 6 years ago, Hannon immersed himself in understanding everything about mobile integrated health, and also how we could help patients at risk in the areas where we service in the Bronx and also in Westchester County. He's developed an incredible and dedicated team of community paramedicine individuals that work with him at Empress EMS and go out to the communities and help people. The incredible thing in terms of timing was that with the success of the program that Hannon started in the Bronx and in parts of Westchester County, lo and behold, in March, as the 911 provider for the city of New Rochelle in New York, which is just north of New York City, we were thrown into the deep end of the pool, so to speak, when COVID-19 struck this area. And through the knowledge and the experience that Hannon had gained in the programs that he had set up for us, we were well prepared to handle the COVID-19 situation. We not only responded as an EMS organization would, but then Hannon made sure that our community paramedics followed up with a lot of the patients, because we also found ourselves in a treat in place situation under mandates from regional councils and Department of Health. So we were well prepared, and we benefited greatly from his expertise. Hannon worked very closely with New York State Department of Health to set up the first drive-through COVID-19 testing site in the city of New Rochelle, which we believe has become the model for many others as they've had to cope with and deal with this incredibly horrific pandemic that we're all fighting every day. So I can't tell you how incredibly proud I am to sit here and represent Empress EMS and Patient Care EMS in this award. And we thoroughly thank you for bestowing this honor on Hannon. So thank you.
Thank you, sir, for that background. Yeah, I can't even imagine what you all were going through up there. But and my wife is from Westchester County, and so yeah. So yes, keep up the good work. So is Hannon on?
I am.
You are. There you are. There you are, Mac. Good.
Great. Thank you, Chip. A little bit humbled by Jim's statements, and unbelievably appreciative of such a prestigious award from an organization like AIMHI. Value all the information you folks put out on a daily basis and consume it voraciously. I think the big number one reason why I was fortunate enough to receive this award really is, as Jim mentioned, it's the team here at Empress and Patient Care EMS. I was very fortunate 6 years ago when I stuck my toes in the water of MIHCP to have a company and an administration that embraced it and was innovative and agile and willing to listen to some of my, at times, what probably sounded like nonsensical raves about where we should be and what we could be doing. And a few years later, we started doing it, and we've been incredibly successful in a state that is very challenging to provide community paramedicine in. You know, we may be innovative in some ways, but we're, and as you all know, the bureaucratic cornerstone of America. So having said that, my thanks to Jim and Mike and Herman and everybody who's supported us and has allowed us to really look towards the direction of mobile healthcare as the true future of EMS, to a team of 12 community paramedics who on every single day, day in and day out, are as dedicated, passionate, and compassionate about healthcare and the improvement of community care as anybody I've ever met. You know, COVID just happened. I think we were fortunate to be somewhat prepared, but nobody was truly prepared. And our community paramedic team was the first group to respond to the mobilization requested by New York State. They were the first to do testing in nursing homes and high-profile locations. And because New York State implemented what was very scary to many of our patients, a viral pandemic protocol, which in some states probably wouldn't have been as scary because, again, a little more used to treat in place. But on a daily basis, we were leaving, you know, literally hundreds of patients at home with a sheet of paper telling them how to follow up with their health care in the scariest time in healthcare in the Northeast. So we decided early on that the best thing we could do in between our other tasks was assign a community paramedic to reach out to each and every one of those folks by phone within 24 hours of their encounter, do another over the phone screening with them, see how they were feeling, see if they had any symptoms, and then look at their social needs. Did they understand the instructions they were left with? Did they really need to seek an alternative health care other than the hospital? Were they okay at home? And if any of them had a concern that was a high enough level, we dispatched a community paramedic to do a follow-up visit with them. through those, I think we reached out to about 1,400 or 1,500 patients until it just kind of became the taper side. And fortunately, we only had to respond to about 42 or 43 patients, and maybe, I believe, at the last 3 were transported. So the protocol worked, but the support, I think, the community got great feedback from the community goodwill. The other thing interesting, Dr. Abrashkin, you know, we were attempted to stand up telehealth pretty quickly, but our partner who we're working with, interestingly enough, with many years in the emergency medical service side, also believes that telephonically can work rather well. And our relationship with them is similar to what Dr. Abrashkin mentioned. If we fail on the video conference side, they're 100% willing to provide us, you know, just virtual telehealth through the telephonic side. So we're going to move forwards as part of our program, even though it's not a community paramedic program. We're aggressively starting our ET3 program on the 1st. And we believe that we're well positioned for success because of the success our community paramedics have had in the field. We're going to use their training and their guidance to oversee the system and to make sure that our patients get treated the same, whether they're low level acuity or high level, you know, CP responses dispatched by a hospital. So again, thank you, Jim. Thank you, everybody at AIMHI. Thank you to Empress for allowing, you know, this program to move forwards. Can't tell you how much I appreciate this.
Well, congratulations to you. Well-deserved, impressive work you're doing up there. Thanks for showing the rest of us how we should be doing it, and look forward to seeing how you come up with the next great thing to challenge to overcome. So
thank you very much.
Congratulations.
Thank you.
So that pretty much brings us to a close of the awards. Once again, I regret that we couldn't be doing this in person somewhere and going out afterwards and, you know, getting to know each other better. If you think that, you know, AIMHI as our organization might be a good fit for your agency or department, you know, and please reach out. We're always looking for innovators, which obviously everybody on here is, and so if I'm interested in membership in AIMHI, we're always looking for good folks to join us. So let's have one more round of applause or whatever we do for all of our winners. And I just want to thank everybody for joining us today. Congratulations to all the winners. Thank you very much for all the folks that took the time to nominate the winners. And thank you again to Amanda for making sure this worked. So that's all I have. Thank you very much.
Thank you all.
Thanks, everyone. Congratulations. If you want contact information for anyone on this call, just shoot me a note, and I'll make sure that I connect you, because I saw some notes in the chat that people have questions and ideas and cross-pollination. So,
thank you very much.
Thank you.
Everybody have a great day.